Hello guys, welcome back to my YouTube channel InfoBro. This is me, your InfoBro. So today's topic is Stevens-Johnson syndrome. So what is Stevens-Johnson syndrome? Let's dive into the topic. It is a severe idiosyncratic reaction characterized by the fever and mucocutaneous lesion. So what is it? It is a severe idiosyncratic reaction characterized by the fever and mucocutaneous reaction lesion. So this can lead to or culminate into or could lead to form epidermal necrosis and slowing. So these lesion or fever culminate into the epidermal necrosis or slowing. So what will be the causes of this? So there are three causes. One is due to drugs, and other due to reinfection, and another due to the rare occasion in a rare causes. So in drugs, it can be due to the anti-gout drugs like allopurinol, antibiotic drug like cephalosporin, antipsychotic drug like carbamazepine, and due to NSAIDs like ibuprofen. Now for the infection is caused by the mycoplasma pneumonia. And now for the rare incidents, rare causes due to the vaccination, and other is the chemical exposure, herbal medicines, foods like food or herbal medicines. All these are the causes of this SJS, that is Stevens-Johnson syndrome. Now let's move into the what are the clinical features of this SJS, that is Stevens-Johnson syndrome. So the clinical features are: it is a condition involving less than 10% of the body surface area. So it involves less than 10% of the body surface area. There will be a history of drug intake prior into the onset of the rash. There will be a history of drug intake, and it is symmetrically distributed. And these rashes are start from the face and thorax. Start first on the face and thorax, and the lesion, and I already told about it, what will be to progress. It will lead to the epidermal necrosis and swelling, which I already discussed. And now there will be a target lesion will be present. Target lesion will be present, and mucosal membrane that are involved in this condition is ocular, oral, and genital. These are the mucosal membrane that involved. So all these are the clinical features. Now for the investigation, what all investigation need to be done? So anemia and neutropenia may be present. So thereby we can conclude it has SJS, and AST and ALT will be elevated, and skin biopsy may be required for the investigation. Now for the treatment, how we can manage this condition. So first is the treatment of the underlying cause. So withdrawal of the causative agent. So we have to withdraw the causative agent, thereby we can undo this condition. And now for the maintenance of the fluid and electrolyte balance as a supportive treatment, that is maintenance of the fluid and electrolyte balance. Now the second one is the antihistamine for the mild cases. Antihistamine and steroid for the mild cases, and silver. Now for the next one is the systemic corticosteroid are indicated for the severe condition. Now for the mild it is antihistamine and steroid, and systemic corticosteroid for the severe cases, and then the silver impregnated nano crystalline gauze for topical wound care. So what is it? Silver impregnated nano crystalline gauze for the topical wound care. Now for the in severe condition, we can also do the IV immunoglobulin. in severe condition, we can also do the IV immunoglobulin. Now for the differential diagnosis. So what all are the differential diagnosis? Erythema multiforme. The first one is the erythema multiforme, and the second one is the paraneoplastic pemphigus. Paraneoplastic pemphigus. That's one is the next one. And the third one will be the toxic shock syndrome. Here it is, there is a mistake, that is TTS. It is toxic shock syndrome. This can be remembered by the mnemonic PET. 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 So all these are for the topic. Thank you.